What are the main speech sound milestones that you should be looking out for as your child approaches kindergarten? Maybe they're about to turn 5 years old, or maybe they're between the ages of 5 and 5.5, and you just want to know which sounds should be coming in, which sounds is it okay to say incorrectly? Well, you've come to the right place. Hi, my name is Amini. I'm a speech and language pathologist with several years of experience working with children and their families to maximize speech and language development. I also have a private practice, Smarter Speech, in the Bay Area, California, where I do the same. And my mission with this channel is to empower parents and caregivers of children under the age of 5 with little info and tidbits that can really help boost speech and language, because now is when a child's brain is developing so rapidly, and the foundations that we set now can set learning foundations for the years to come. So without further ado, let's get into it. In terms of what I'm looking for speech sound milestones, I do want to clarify that speech and language are two very different things. Speech talks about the actual sounds, the speech sound inventory that a child is saying, and how clear a child might be. Language, on the other hand, talks about the actual thing that's being said. It's the actual content, the words, the sentences. There is a video about language for 5-year-olds. You can check that out in the description box below, but now we're only talking about speech sounds, which is how clear your child is, which is very important because they want to be able to get their point across, and you also want them to have good self-esteem and a good foundation for reading and writing. So the first thing that I look for is, it's kind of a dual milestone, actually. So at the age of 4, a child should be 100% intelligible. That means that the age of 4 itself, most people who don't know your child very well should be able to understand what it is that they're saying. This doesn't mean that everything is correct, but it does mean that for the most part, their speech is clear, that people aren't confused after your child says something else. So that's a given. If that's not the case at 5, it's a very good idea to reach out to a speech therapist or to the school teacher, or to mention that to a pediatrician. The next thing that I look for is L, S, and Z. These 3 sounds start to come in around the age of 4, but they're definitely more prominent, and they should be correct much more as a child is turning 5, or maybe is approaching 5.5, and maybe is even in the later part of being 5. So L, S, and Z should be pretty correct for the most part. And you can check them with plurals. So cats, dogs, you can check for that S and Z, see if your child has it, maybe when counting toys on the playmat. The other thing that I check for is the L sound. So I check for it in words like and love and all. So those, again, should definitely be getting more clear and less inaccuracies in those 3 sounds. And the next thing that I look for is sh, ch, and j. So these are sounds that start to emerge at the age of 5. And all 3 of them, you make the sound by pushing the lips out. I call this fish face. You have to push the lips out to make sh, ch, and j. This can start coming in at 5. It can continue to come in around 6, but you should at least hear it sometimes. So when your child points out fish, for example, or when they're talking about changing clothes, or when they talk about peanut butter and jelly. Those are the 3 places where you can really watch to see whether you're hearing those sounds. Sometimes these sounds come out from the side instead of to the front. So for example, if I'm saying fish, maybe it sounds something like fish. Like it doesn't, the lips don't come forward. That's a very common error. And if you continue to see that as your child is progressing through the age of 5, that is something that you want to get checked out, because that is an error. And oftentimes that can be accompanied by some other errors, like a lisp, because when a child is taking a front sound and is bringing it to the side, sometimes you'll see a lateral lisp with that. Not always, but sometimes. If you want to find out a little bit more about lateral lisps, you can check out the 4-year-old video linked below. But basically, a lateral lisp is when sounds are made from the side, sounds like S and Z instead of from the front. So chances are, if you're hearing something like this, you might also be hearing something incorrect on the S and the Z, especially if your child is approaching 6 as opposed to 5. So again, sh, ch, and j should be emerging, and they should be emerging with the lips pouting outwards. The last thing that I look for is blends. So a blend is when you put 2 consonant sounds together. And in my video about 4-year-old milestones, I talked about past tense ed. That's definitely something that I would expect to see at least some of the time, if not most of the time, on a 5-year-old child. So if they're saying or something like brushed, I want to hear that ed after the sh. Or if they're saying something like combed, then I want to hear that ed at the end. Or if they're talking about any sort of a verb that you can think of. So maybe they're saying something like they played. Again, I want to hear that D at the end. So that's one to look for. Another blend that I often look for is an S blend at the age of 5. That tells me whether or not a child is able to kind of condense consonant sounds. So some S blends that I look for are SM, like with small, SP, like with spoon, SL, like with slow, SK, like with skip, SN, like with snack, and ST, like with stop. So if a child is saying these sounds correctly, they'll often, incorrectly, then they will often drop one of the sounds. So small would be mall or sol, or spoon would be poon or soon. And again, some errors are okay, but if this is consistent and you really don't see that it's getting better after a few months, that is something that you want to mention to a teacher or a speech therapist, maybe even a pediatrician, so you can get a referral for a speech therapist. That being said, 5, if your child has joined kindergarten, there's some good news. At the age of 5, in a public school system, if you continue to see errors with speech sounds, you can talk to a school teacher and you can also request an assessment. So if after some monitoring and after some intervention in the classroom, you really feel like these sounds or overall clarity is bothering you, it is totally okay to request an assessment with the teacher. That way the teacher refers the school speech therapist, and then they can have something called an IEP or individualized education plan meeting, where they talk about if your child will qualify for some weekly therapy to try to get in there and fix a few of those sounds earlier as opposed to later. There are some caveats here. Your child has to test low enough to qualify, and that cutoff is pretty low. So if it's just a few sounds, you can wait it out. But if you continue to see that these sounds aren't correcting or there's more than a few sounds, definitely talk to a teacher. Think about requesting that assessment with your school speech therapist. And of course, that is mostly in the United States, but I'm sure that there are other similar procedures in other countries. You can always talk to your teacher and find out what the procedure is. This is, of course, talking about just American public schools is the way that I described just a second ago, but you can always talk to the teacher to see what the policy is in the private school or in whatever area it is that you live in. All right, so I hope that these tips helped you. If they did, check out the description box below. I have some other resources that I think you might like. There's our mailing list. You can sign up for free monthly tips on speech and language development. We've also got ebooks, parent education courses. So there's plenty of materials linked below. I really hope that you enjoyed this video. I hope it was helpful. Thank you so much for watching and happy talking.